I just have to breathe hard. I have to go at a steady pace that's not too fast, or I will get very much out of breath. Thinking about breathing, really, that's a full-time job sometimes.
It's like somebody squeezing your chest and your lungs and not letting the air in. So you're gasping, trying to get the air in. The impact that asthma has on your life is kind of a daily thing. You can't walk, you can't eat, you can't, like, drinking water is hard. Talking, like, it really affects everything you do. You just can't, you can't do any of it if you can't get your breath.
So I'll just open the door for you. Okay.
What we know is that these diseases have been around for a long time. For example, asthma was first diagnosed by Hippocrates 2,500 years ago. But what we understood the diseases to be was more diffuse and sort of homogeneously spread throughout the lung. What we've done in the lab is used imaging to kind of shatter that paradigm.
Right, I want you to take a breath in, blow all your air out.
What we've been able to do is exploit some of the physics that's understood about certain nuclei that are present in the atmosphere. And some of these gases can be polarized with lasers so that you can actually see them in an MR scanner. So the advantage is not only do you see the rest of the body, but now you can see where gas goes and where it doesn't go.
When I saw the picture of my lungs and realized they weren't a normal lung, they had lots of spaces where there wasn't any air exchange, it was scary.
My wife and I would take brisk walks, and she commented that I seemed to breathe awful heavy. She asked me why. I said, well, I don't know, it's just the way I breathe. And about 3 years later, after being sent to a respirologist, Dr. McCormack in London, I was diagnosed with emphysema as a result of alpha-1 antitrypsin deficiency.
I think this line of inquiry is definitely going to open up new therapies that will hopefully improve patient care, because we believe that this regional distribution of the disease within the lungs probably will allow us to provide regional therapies as opposed to delivering medications to the entire lung.
It's only through research that we can find new treatments, new measurement technologies that can measure how effective treatments are. And I hope that by being part of it, that it'll help future patients who have the same disease.
I think most of us who work in patient-based research see the burden of disease and the unnecessary suffering. I certainly went into this line of work because I wanted to make a difference, and I wanted to make and understood that every day mattered, and every day we get closer to our goal.